The Strongaloides worm is a potential problem for northern Aboriginal communities. The Yowie team caught up with Associate Professor Rick Spear at the first National Strongaloides workshop in Nhulunbuy recently to find out more on the issue.
Strongaloides is it's a parasitic worm and it lives in the small intestine. It's about 2.5 millimetres long. It's not a common worm in mainstream Australian society, but it's present within Aboriginal communities at a really high level. Some of the highest levels in the world are present in communities in Northern Territory and Western Queensland.
What's the difference between this and other parasitic worms?
This worm can multiply in the body. So potentially a person could start off with a very low number of worms, but within 6 months or a couple of years they may have thousands and thousands of worms present in their body. This occurs when a person's immune system isn't functioning very well, and if the number of worms build up to quite a high level, people can die from it. It's picked up from the soil. There has to be bad hygiene involved, so a person infected with Strongaloides has to go to the toilet on the ground, so you have to get faeces sitting on the ground. There's larvae, baby worms sitting in the faeces. They develop for about 3 days, and then they're very actively looking for another person to get into. So if someone walks past that area and stands near where those baby worms are, or if they sit down on the ground next to those worms, the worms will actually chase them and get into their skin, and they burrow into the skin, go down through the hair follicles, get into the bloodstream, and then go back down to the intestine where they live. Most people who have been infected as children, probably at least 70% of them have had episodes of those itchy skin lumps, and probably at least 50% of them have actually had pain in the abdomen. They're not terribly sort of serious symptoms, and so people might just say, oh, you know, I get these funny rashes every now and then, and disregard them. But if you find old people with the parasite and you question them closely, they've usually had these symptoms for many, many years.
What are the cures and treatments for Strongaloides?
The treatment's quite simple. It just involves taking tablets. There's 2 types of tablet that you can take, one called albendazole and another one called ivermectin, and they're tablets specifically for treating parasitic worms.
And where do people get the treatments from?
They can't get treatment through the chemist, so they've got to go to the doctor or a health centre and get a prescription to get the tablets, or get the tablets from the health centre. This parasite is really quite a serious parasite across the top end, and it's very common, but it appears to have been neglected, and people really haven't been very aware of it. And I think for other communities, they should try and make some attempt to find out how common it is within the community, and to see if it is a problem within their community, and if it is a problem, to work out strategies to actually treat it.